Hello and welcome to the Open Day presentation for BSc Honours Midwifery with Professional Registration. My name is Catherine Angel and I'm the lead midwife for education. So this introduction is an opportunity to find out more about the midwifery course provided at Bournemouth University. Thinking about what midwives do is key in your journey. So right at the beginning, think about what you find enjoyable in terms of caring for people and in terms of what you're thinking about for your career. Midwives provide care for normal and complex childbirth. They offer evidence-based information to women and families and provide individualised support for women within their social worlds. Midwives work in community, birth centres and hospital settings, and it's really important to remember that midwives work 24 hours a day, 365 days a year. So you need to accept early on that part of your working life is going to be about working the kind of parts of the year when most people are perhaps on holiday or asleep. The midwifery course at Bournemouth University is a degree course, a BSc Honours. It comes with professional registration as a registered midwife, and that's the only way in which you can work as a midwife in the UK. It's what's called a direct entry course, in that it's a degree in midwifery. It's not a nursing degree in which you then transfer into midwifery. It's really important to recognise this because it's quite difficult to make a transfer from nursing to midwifery these days. There are not that many courses. So if you want to be a midwife, do a direct entry course. It's a 3-year course which is full-time, and by full-time we mean a 37.5-hour week. And the course is 50% theory and 50% in practice. So that's working with midwives and other health professionals in trust NHS settings. At Bournemouth we take just about 80 students per year, and those students study on one of our 2 campuses, either at St Mary's in Portsmouth or on the Lansdowne campus in Bournemouth. And the clinical site that you might work on is linked to the site that you end up coming to for your teaching. So generally students who are doing their clinical practice in Portsmouth, Winchester and the Isle of Wight study in St Mary's, and students who are doing their clinical practice in Poole, Salisbury, Dorchester or Yeovil do their studying at Lansdowne campus. The student year for midwifery is a 45-week year, and we have fixed holidays. It's really important to recognise that you can only take holidays in the designated periods. So that's 2 weeks at Christmas, 2 weeks around about Easter, and 3 weeks in the summer. We try to give the first and the second years their 3 weeks holiday during the school summer holiday, and the third years normally have a flexible summer holiday break. Your study is arranged in blocks of learning, so you have blocks of theory and then blocks of time when you are in clinical practice. So theory learning is undertaken in blocks. We run what we call a uni-professional midwifery curriculum, and that means that almost all of the study that you undertake will be just with midwifery students with aspects involved in midwifery. However, there is some interprofessional learning in year 2 and 3, where you work with other health professionals on particular projects, such as learning about research or undertaking service improvement projects. The course is taught in units, 6 units per year, and each one is focused on different aspects of care. We try to make this relevant to the practice that you'll be undertaking, but we do tend to find that there is obviously overlap. As you learn about something, you will then perhaps go and study it, or vice versa. The plan is to make a very integrated programme so that you're constantly using and learning and then relearning the skills. When you study at degree level, the theory learning will include some taught days, but also a significant amount of self-managed study, some collaborative work in groups, independent study and academic reading. So it's really important that you have a good sense of motivation and time management in order to be able to work your way through the programme successfully. We have some great learning and teaching facilities at Bournemouth and in Portsmouth. Bournemouth is on the university campus, so we share that with a lot of other professional groups, but we have excellent skills labs and teaching accommodation. And Portsmouth is in its own bespoke unit, but it also has its own clinical skills lab and teaching rooms. The programme is obviously assessed to ensure that students are reaching the requirements of the Nursing Midwifery Council and the university, and our assessments integrate theory and practice. We have a wide variety of assessment styles, and this enables all students to have successes in different areas depending on their particular skills. We have essays, case studies and reflective writing. There are some group presentations, some spoken exams, vivas, some written exams, simulated practice assessments, and also every year there is assessment in practice. And you must pass every assessment in order to progress from year to year. Some of our previous students. There are several things about the programme which are very important to us. The first is that we've been extremely active in teaching the newborn and infant physical examination, NIPE, and we're already introducing our students to this programme as they move through the course, but we're expecting this to be more and more an essential part of curriculums in the future. So the fact that we're already ready and are teaching this is quite significant. We're also one of the earliest universities to gain UNICEF UK Baby Friendly Initiative accreditation. We've held that for many years now, and very well respected for our teaching of infant feeding, including the use of our bespoke online package, BURP. We're also leading the way in creating virtual reality learning environments for student midwives and other health professionals within the university. And this gives a safe environment for a considerable amount of learning particular skills, and we're gradually introducing this to different skill areas as and where appropriate. In terms of what you might expect to see in practice, practice comes in blocks and students spend time in community, intrapartum, postnatal, antenatal and clinic environments. Some of our trusts operate integrated care where the student stays with the same midwife and works with that midwife in a variety of settings, and in others you would work with different midwives in different parts of the trust. Students are also expected to undertake health and wellbeing visits and work in women's health areas of hospital and neonatal care. Students work with their midwifery supervisors in practice locations, and then they are assessed by their practice assessors. Our senior students also care for a small caseload of women who they see from the beginning of their pregnancy, go on call for them for labour, and then they see them at the end until they're discharged to the health visitors. In terms of how you would work in practice, students are expected to work with your supervising midwife across all shifts. Students work days and nights, including weekends and bank holidays. So when supervising midwives are available, that would tend to be when you would work. You may have a number of different supervising midwives, even in the same location, depending on availability of staff to work with students. The lengths of shifts vary in different trusts and in different settings, but most commonly are 8 or 12 hours. When working in the community, many students do on-calls, which includes nights and weekends. And we ask that all students do 4 weeks of night duty a year, just so that you begin to learn the skills of staying awake at night and also the different activities that go on during night shifts. As I've said earlier, our students undertake case loading, and Bournemouth University pioneered case loading many years ago. And we offer a full caseload experience, which is extremely beneficial to students. We also offer an elective placement where students go and work in locations of their choice with up to 3 weeks away from one of our BU practice sites. And this gives you the opportunity to consolidate learning and see different kinds of midwifery. In terms of accommodation, students may choose to live at home or accommodation near their practice site, or they may potentially choose to live in our halls of residence or in Bournemouth or in Portsmouth and then travel to a Portsmouth site. And it's a good thing to have a discussion with us, an interview about where might be most appropriate for you. We have a very large midwifery team at Bournemouth with a lead midwife for education, a number of midwifery academics, and all of us are registered midwives and we all have links to practice. We're all undertaking research or doctoral studies and we have a very wide range of specialisms which we bring into our teaching. We're also very lucky in having 3 professors within our midwifery and maternal health team, and that brings an enormous breadth and depth of experience to what we are able to teach in terms of our undergraduate and postgraduate courses. In terms of student support, there's a wide range of support. You have academic support from a year tutor who's assigned to each cohort, a personal academic advisor, and the lead midwife for education. We also have a facility called Snack Chat, where the programme lead and the year tutor meet with each group every semester in order to talk about their experiences, anything exciting that's happening within the group, and any ideas that you've had about improving the programme. Additional learning support and academic skills workshops are also extremely helpful for students. In practice, students are supported by their practice supervisors and assessors, as well as professional midwifery advocates, and by the academic advisor team who visit trust sites regularly in their role as linked tutors. Many students get a lot of support from their peer group as well, and that may be informally, just as friendship groups, but also in terms of the Student Midwifery Council and our PALS service, where students in other year groups support new students as they enter the programme. As with all universities, we have a range of pastoral support, counselling service and faith and reflection service. Bournemouth has a really active midwifery society who organise balls every year as well as talks, and our well-respected midwifery student conference, which happens every year and has a very wide range of international and national speakers. In terms of our programme outcomes, we have excellent academic outcomes in the programme, and students very quickly find employment either within the local area or more far afield if they choose to go and work elsewhere. Many of our students remain working in their trusts where they've been studying, although they can obviously go and work anywhere that they choose. In Bournemouth, we're very fortunate to shortly be moving to our new home, the Faculty for Health and Social Sciences Gateway building. If you have any questions, please do feel free to ask our admissions department, and they will be able to forward queries to our admissions lead.